looking at my nose. Let me know when you can no longer see the light. So I'm going to run through a few sort of annual checks. I'm just going to come in on this side now. When did you start noticing these changes? Okay. Hello. Oh, thank you, Sarah. Yeah, send them straight up. All right. Good afternoon. So, sorry for keeping you waiting downstairs. Really busy day. But now this time's all for you, so we can go through just how you've been feeling recently, and why you booked the appointment today. And then I haven't seen you for a little while, so I'm going to run through a few sort of annual checks, things like that, if that sounds alright. Okay. I'm going to take some notes while you talk, so if you want to go ahead and just explain how you've been feeling and what you want to specifically talk about today. Okay. Tired? Yeah, okay. Go ahead. Yeah. Okay. When did you start noticing these changes? Okay. Okay. Are you still working? Yeah, I can imagine. Okay. Alright. And any sort of recent changes in your lifestyle that you're aware of, that you can think might have had an impact on this? Yeah. Okay. So, a little bit of stress. Alright. Okay. And are you on any medication? Yeah, okay. Well, did I prescribe that? Yeah, okay. And what's your dose? Okay. Overall, how are you finding that? Okay, perhaps we can talk about that at the end. Alright. I'll just make a note to self. Okay. Perfect. So, what I'm going to do now is just take an overall look at you. And then I'm going to just do a general exam, alright? I'm going to just have a look at a few areas, check your skin, check your eyes, things like that. And then I'm going to move into some basic checks, check your blood pressure, heart rate, pulse, and then we'll move on from there. Does that sound okay? Alright. So let me just pull up your notes. just going to pop some gloves on because I'm just going to start with a physical exam, okay? How's your family doing? That's good to hear. Alright. Take a nice deep breath. And then just relax the shoulders, unclench the jaw. Okay, you're in a safe space, alright? There's no rush. I'm going to be very thorough. And we're going to help you and get to the bottom of this. Alright. So, I'm going to just start with your face. Just looking at your eyes, making sure the whites are nice and white. Looking at the colouring, if there's any red spots. And under the eyes. Okay, looks all alright. Look at the overall sort of general colour of the face. Nice rosy cheeks. Okay. There's no lesions or any sort of skin concerns. Just gonna check this ear first. Okay, just having an overall look right now. I am going to look in more detail in a moment. Right, I'm going to look at your lymph nodes, okay? So we're looking for anything that stands out. Any twinges, aching, pains? Okay. Sometimes the lymph nodes can act a little strange, but they're usually a good indicator of our overall health. Okay. So we have two glands on the neck, here and here. And these ones tend to swell with sort of colds, things like that. And then we go down the neck and we have some more nodes just above and around the collarbone. These ones look great. I can't, they're not standing out to me. Okay. Okay, I'm going to just put my hands behind your neck. I'm just going to feel on the back of your neck behind your ear. There's some more there. All sounds okay. And feels okay. Alright, if you could just raise one arm, that's great. I'm just going to feel just in your underarm region. just lifting this one a little bit more. Sorry there. Thank you. Yeah, okay. Right. Just going to... Are you wearing a vest? Yeah, okay. So I'm just gonna lift your top. Just gonna put that to the side there. Tuck it. I'm just gonna have a look over your vest. See if there's anything that stands out. Okay, I'm going to just press a little bit around your abdomen. Any pain when I press here? No. Your tummy's got mainly just soft tissue. It's a really good area to do some palpation, to feel some organs, make sure they're all okay. Okay, is your spine feeling okay? Yeah, okay, I'm just gonna have a little feel around your cerebral cortex. No pain. Good movement of the neck. Yeah, perfect. And hands, and look at your nails, another good indicator. Okay. Do you tend to have fairly soft nails? Okay. Perfect. I'm not going to check on the waist down because we're going to do some different tests now. Okay. Just going to pop my gloves off. Just going to make a note. Everything was normal. Okay. Just in case that wasn't evident. And, 9 times out of 10, everything is normal, okay? So, sometimes the actual worrying can make us unwell. So it's always best to just be present, not think too hard. If anything worrying does come in, you acknowledge that it's a fear, it's not your reality, and then just let it go. And then if you are struggling with worry about health problems, I usually would suggest giving yourself a few days and then booking a GP appointment, not reacting instantly. Because sometimes after a few days the fears pass and we look at things a little bit more logically. And that's my personal experience suffering with health anxiety as a doctor, I know. But a lot of people do suffer with it, so you're not alone. Okay. Alright, let's do your blood pressure. Okay. Which arm shall we do? Alright, let's do this one. Yes, I don't use the machine here because I like to feel the response from the blood pressure machine, and you can't do that with the modern ones. It's very hard, so I'm an old school doctor. Just put your arm through there. Lovely. Alright, so just relax. A little bit tight, I just need to do this to get a good reading. Absolutely normal, okay? I'm just going to let it sit there just for a moment, just to be sure. Just for some extra reassurance, I'm going to have a listen. Really strong, lovely and healthy. Okay. Okay. You okay? Good. Just going to let the air out. And that's all done. Okay. Right, so I'm going to listen to your pulse now. Okay, I'm going to use my stethoscope and I'm also going to hold your wrist. So let's do this side as it's already there. Okay. Alright, there it is. I'm just going to sit here for a moment, okay? That's perfect. Yep, okay. Alright, I'm going to listen to the other side now, so just show me your wrist. The other side. Okay. Thank you. Let's have a listen. It's going to be the same. I'm very thorough. Okay. Yep. Perfect. Okay. And while I've got the stethoscope out, I'm just going to have a listen to your lungs and heart now. Okay. So I'm just going to move your top. Perfect. So nice and relaxed. Some people have something called white coat syndrome where when a doctor or a nurse examines you, tend to have elevated levels of most things because you get nervous and it can skew results and things like that. So nice and relaxed for me. Okay, let's listen. Just going to move it slightly. Okay, just up here. Yeah. It's going to move it down to your heart. Do you have palpitations? Sometimes when I have a health anxiety spiral, I get heart palpitations. And before, I was a little bit less aware of what was going on, so I used to think, oh well, now I've got a heart condition I need to worry about. But actually I get palpitations whenever I'm anxious. And sometimes the palpitations are a nice reminder that, hey, you are feeling anxious right now, and it's got to the point that now your body is reacting, so let's acknowledge this and let it just pass. Allowing thoughts to pass has been the biggest thing to help, because nothing bad happens when I don't think about it, and it doesn't change anything. Great. Heart sounds great. So I'm going to ask you to take a deep breath in now. And out. And again. And out. Perfect. And then I'm just going to lean over. Deep breath in. And out. And again. Deep breath in. And out. Perfect. Have you had a cold recently? Okay, yeah. Still a tiny bit of mucus, but that'll pass. It's very minor. Okay. Right, so because you've had a cold, I'm going to check your ears, nose and throat. And your eyes at the end. So let's do your ears. Any itching? Okay. Any pain? No. Perfect. And it's all connected, our ears and our throat, so sometimes we can get sensations in our ears, so it's actually a throat issue, and vice versa. So I'm going to have a look in both. So I'm going to come in nice and close now, and I'm just going to have a look on the left ear, and yeah, that's a little bit of wax build up, but nothing to worry about. And then just gonna turn the angle ever so slightly. And yeah, perfect. Okay. Sorry. Just gonna come in on this side now. And again, everything looks normal. Just gonna turn the angle. And that's perfect. Okay. Yeah. Just a little basic ear test, hearing test. So, just looking at my nose. Can you hear that? Yeah. This. Okay, and closing the eyes. And then just let me know which side you can hear this. Perfect. Oops, let's put this on. Alright then, so I test. Looking at my nose, I'm just going to have a little look first. Alright, I'm going to come in nice and close. And just lifting the eyelid up, look down. Okay, that looks great. And then look up. That's perfect. And then let's go on this side. So look down. Look up. Okay, eye health looks great. Just going to do some light tests now. So I'm just going to have you follow the light. That's wonderful. Okay, and I'm going to have you look at my finger. Look at my finger. Look at my finger. Perfect. Looking straight at my nose. Check pupils. Going in a little bit brighter. Okay, looking at my nose. Let me know when you can no longer see the light. Good. No longer see the light. Good. No longer see the light. Good. No longer see the light. Good, sorry. I was up a lot last night with my little one, so I keep getting my words jumbled. Okay. If you could just tip your head back slightly. I'd just like to do a little nose check. Just take a deep breath in and out, and then again. That's wonderful. Okay. I'm gonna have a look in your mouth. So, if you could open nice and wide. No, tonsils look healthy. Swallow. And again, swallow. Perfect. Okay, just eyes open again. I'm going to look at my other light. Okay. Looks great. Alright, I'm just going to ask you to take a step back, then just put your feet on the scales, lift yourself off the chair. Okay. And then lifting the head up. And then I'm just going to look on the chart, keeping the head nice and still. Okay. And then just relax and sit back down. Thank you. Okay. It's all great. How much exercise are you getting? Okay. Yeah. Start small. Yeah. Walking is the best. It's the exercise humans were designed for, so walk as much as you can, and just choose to walk instead of drive, and over a week that will amount to a lot more exercise, so there's somewhere to start. Unless of course there are other things you enjoy. Okay, I'm just going to work out your BMI. Alright, perfect. And that's normal for you. I can see your chart. Okay. Right. I'm going to just check some of your cranial nerves now. I want to make sure that we are not missing anything, okay? So, I've checked your eyes. I'm going to just check again. How many fingers am I holding up? Perfect. And then just following my finger. Okay. Looking at my nose. Looking at my nose. Okay. And then following my finger some more. Okay. Just gonna touch around the face and next to the ear. Is that triggering any pain? Numbness or tingling? No. You can hear all of this, yeah? Perfect. I'm just gonna lightly touch down your body. Any tingling? Oh, okay. Anything? No. Okay. You just put your hands out like this. Don't let me close. Don't let me close. And now I'm going to cover your hands with my hands. And just try to open. Okay, nice and strong. Again, I'm going to ask you now to swallow. Okay, any pain into the ear? No? Okay. Perfect. Have you noticed any issues with your smell at all? Okay. And then just checking the facial nerves one last time. If you could just copy my expression. Perfect. Yeah, you did that perfectly. Okay. Right now, let's have a look. Right. So, based on what you came to me with and your absolutely normal results from everything else, I'm going to issue a request for a blood test, and particularly your thyroid levels and your blood, to check for iron, which is a possibility. Okay. So let me just get that printed. Let me just see if they've got space downstairs. We do have a walk-in clinic, and in about an hour there are some spaces for a blood test, so I don't know if you want to go grab a coffee and then come back. Yeah, alright. Let me just ring the front desk. Just give me 1 second. Hi Sarah, hi. I've got a patient here who would like to have a blood test done. Could you please book them in for 1:15? Yeah. Yeah, no, just one vial. Perfect. So I'll send them down to you. Patient number is 1 second. 14362. Perfect. I'll give them a slip. Yeah. All right. Thank you. Bye. All right. So when you go downstairs, you'll give them the slip. Give them the slip, and then she'll give you your appointment card, and then they'll just call your name. It'll be on the screen. Alright. So, you wanted to review your medication. Yeah, okay. So, so this is 500 milligrams. This was what I was going to give you today. Okay. So, you want to increase the dose. Alright. And that's because... okay. So we don't do any higher, but I can give you something else which should supplement it, and it's less aggressive, so yeah. Okay, perfect. Your usual pharmacy is still Sunnydale? Perfect. This will go to them. Alright, should be 30 minutes. Yeah, okay. Perfect. Was there anything else you wanted to chat about? Alright. So I will be in touch with your results. I'm going to ring you even if they're normal, so that we can have a chat about what else we could do to help you. And otherwise, you know where I am. Alright, and yeah, downstairs for your appointment and prescription at the pharmacy. Alright, so it was nice to see you again, and yeah, see you soon.